Hello and welcome to another class of topic in Dermatofunction, physical therapy in the women's health. In this class, we will discuss the physiology of healing and the pathophysiology of surgical trauma. My name is Vanessa Ferraz. I'm a physical therapist, a physical education professional, and a master's student in the postgraduate program in movement science at Federal University of Mato Grosso do Sul. To better understand how to treat a patient who has had the plastic surgery, it's necessary to understand the physiology of scarring. The replacement will happen after several expensive and complex cellular events. Therefore, it's very important that the physiotherapist be aware of approaches that be taken in each phase. The inflammatory phase begins at the end of surgery, soon after hemostasis, and reaches its peak of activity between the first 24 to 48 hours. A biological buffer rich in platelet, fibrin, and red blood cells forming the injury area. The initial buffer is important because it serves to attract defense cells such as neutrophils and the macrophages, which move to the side. In the first 48 hours, fibrin and fibronectin present in the initial containment clot form a matrix, which will serve as a framework for the orientation of fibroblasts. There is an increase in vascular permeability, which stimulates the migration of the cells to the site. The injury in the region will present the following clinical signs, such as edema, heat, hyperemia, and pain. In particular, the edema is quite characteristic in the initial post-surgical period, especially in the first 48 hours. The main goal of this phase is the removal of damaged tissue and impaired cells, the restoration of the local defense mechanism, and the release of growth factors in order to recruit cells that will participate in the following phases. The faster we control the inflammatory phase, the better for the surgery and the better, especially for the patients. In the proliferative phase, the second moment of scarring chin, there are processes of occlusion of the lesion, which are distributed in the three stages: neonangiogenesis, fibroplasia, and epithelialization. This process begins on the third or 40 days of the postoperative period and may last for up to 30 days. In this phase, the production of growth factors and chemical mediators is no longer carried out exclusively by the defense cells, but also by fibroblasts and endothelial cells, which will stimulate the following events. Granulation tissue formation occurs, composed of new vessels, fibroblasts, collagen, fibronectin, and hyaluronic acid. Another striking feature of this phase is that some fibroblasts will differentiate into myofibroblasts, which will be responsible for further collagen synthesis and wound contraction. The third phase is that of remodeling. It's begin between the 60 and the 18 week operatively and may last for up to more than a year. In this phase, the organization of the post extracellular matrix occurs both by the fibroblasts and by the myofibroblasts. In the previous phase, the collagen was deposited in a disorganized way and showed little tensile stretch. This phase of paramount importance for the harmonious integration, of all the other components of the new tissue. The degradation of excess collagen The post ensures the softening of the scars and its gradual aesthetic improvement. Therefore, it's important to emphasize that the body has sufficient capacity to heal itself, and the approach of the physiotherapist will intend to control the initial inflammatory phase and guide the following phase in the complete recovery, and any intervention should be performed in the balanced way, respecting the physiology of the tissue that was approached in the surgery and avoid the presence of any possible imbalance between this phase and or development of some intercurrence. Physiopathology of surgical trauma. When the patient thinks about having plastic surgery, there is a false idea that there will be no scars, but the use of special materials and intense fallout also contribute to even better events results. But the scars will exist and will be noticeable. However, the region that will be most affected in all surgeries is the subcutaneous region, more precisely the connective tissue, where the tissue detachment is performed. The region will not need reepithelialization, but is a good control of the inflammatory phase and adequate remodeling phase. The connective tissue in question will be filled by extracellular matrix, which is formed by collagen and elastin fibers, fundamental amorphous substances such as glycosaminoglycans, proteoglycans, and glycoproteins, and interstitial fluid. The synthesis of these proteins will interfere with the quality of extracellular matrix, which function as the medium for cell-cell and matrix-cell interactions. It's contribute to guide cell proliferation, migration, communication, and cell deposition, as well as in the sliding between adjacent tissue. In other words, each and every stimuli that this tissue receives generates an information and a response from the organism. Look at these pictures. In picture A, preserved tissue indicated by forceps. Fascia in figure B, juxtaposed to the musculature indicated by forceps, where tissue resection and detachment is performed for later adjustment in the chosen surgery. Physiopathology of surgical trauma, the myofibroblast. Well, myofibroblasts are cells that have the same function as fibroblasts. The ability to convert a mechanical stimuli through the mechanoreceptors into a cellular activity due to the matrix cells communication. The edema can persist, impairing the patient's functionality, since there will be great tension in this tissue during movement, and the patient will report feeling something pinching him or stabbing pain, as well as burning sensation. Well, the connective tissue responds to mechanical stimulation, which are important for the professional who will accompany the surgery, which increase tissue tension. One can stimulate anabolism, thus promoting greater local cellular metabolism due to the stimulation of the TGF-B1 peptide. If the tissue suffers compression, one can provide inhibition of cellular activity due to the greater synthesis of metalonome proteinases. In turn, if tissue shear occurs, there is reorganization of the collagen fibers of the extracellular matrix. However, there is a decrease in the local activity of TGF-B1. This growth factor is directly linked to the appearance of interstitial fibrosis. In the worth remembering that while any local manipulation should be performed, respecting the direction and stretch that the tissue can allow. Tensions line in the handling of scars figure as another subject that deserves attention. The effect of mechanical forces varies according to anatomical location, depends of the stiffness and biomechanical properties of the skin. In general, the surgical procedure is done based on Langer's line, which are lines present in the skin tissue, and sutures are also performed on those tissue planes. The aim is to approximate the tissue's edges and avoid the formation of gaps, dead space, which are favorable sites to the accumulation of liquid collections and subsequent local infection. Well, that's the relation of mechanic. One must evaluate what is happening with the scar and the adjacent areas so to understand and choose the approach to be used. Each and every chosen therapy should not increase any of the force, but balance them. When there is the need for manipulation of the area close to scar, or the scar itself, a tip is to always perform the movement approximating the edge of the scar without pushing or pulling the tissue. Therefore, for a good recovery, it's necessary that the physical therapists act and contribute through research to a good recovery. The presence of the professional physiotherapist is of fundamental importance in the follow-up of all the phase of the surgery. Interesting factors that interfere with recovery. Some interesting factors can interfere with the patient's recovery and are related to the body's functioning condition. Vitamins and mineral deficiencies with vitamin A, C, D, and E, and substances such as iron, magnesium, and zinc. In fact, the prohibition of smoking before surgery is directly connected with the supply of oxygen to the body, essential for the cells, and just as well as the ingestion of alcoholic beverages can also interfere due to the production of free radicals and dehydration after ingestion of any and all medications. The use of continued use, such as antidepressants or corticoids, must be informed to the responsible physician for proper orientation of use during the pre and post-surgical period, because the continuous use may also interfere in the result of the surgery. Complication related to the surgical procedure. Look at the changes that can occur during the recovery process. Some events are known as possible complications, most concerning in plastic surgery, including hematoma, seroma, dehiscence, fibrosis, and adhesions. In the adhesions, infections, and tissue necrosis. Well, hematoma is the result of the rupture of the larger caliber vessels, which clump together a lot of blood, then cannot spread to the soft tissue and concentrate in a dead space. In some cases, depending on the extent of the hematoma, puncture or removal by surgical procedure is necessary. Seroma is a defense reaction of the body and can be defined as an accumulation of liquid below the skin with exudative characteristics and occurs after manipulation of the skin and adipose tissue. The, the hypothesis of this formation involves large skin cutaneous detachments and manipulation of lymphatic channels with shear force between the scrap and the aponeurosis and the consequent release of inflammatory mediators. Medical interventions is required in these cases. Surgical cutaneous suture dehiscence is the most common risk in mammoplasty and abdominal surgeries and consists of the spontaneous opening of the surgical stitches cause the reopening of the previously closed wound. As a consequence, it can aesthetically compromise the scar and increase the risk of infection. Generally, it occurs between the first stages of the healing process, from the first to the 21st postoperative day. Alterations in the scar tensions for are the main cause of this type of involvement, and the local healing should be stimulated by means of electrothermal therapy research, which may contribute to organize the adjacent tissue and improvement the scar is extrinsic tension. In some cases, the physician is a person in charge performs a new suture for complete closure. The fibrosis and adhesions occur due to some imbalance in the healing physiology of the individual submitted to the surgery, mainly due to the malfunctioning of the myofibroblast. Consequently, there is an excessive and rigid deposition of collagen in the extracellular matrix of the area to be recovered. The permanence of this collagen in a disorganized way can lead to pain and the functional disability of the patient, limiting him or her to perform normal movement. Physiotherapy has efficient research for the treatment of this complication, which can promote normalization of interstitial tensile stretch and promote tissue malleability, returning flexibility and natural movement to the patient. The infection of the surgical wound is considered a serious complication and an important complication, offering risk to the surgeon and also to the life of patients. Every care to minimize the factor that favor infection should be done in order to avoid contamination. Necrosis is a pathological process caused by the degenerative and progressive action of enzymes, usually associated with severe cellular trauma. In the cellular context, the response includes nuclear and cytoplasmic change, such as mitochondrial swelling, nuclear flocculation, uncontrolled lysis, and cell death. The care of this disease complication is the left to the responsible of plastic surgeon. Look at this picture. Post-hit, sorry, Myofibroblast. In figure A is a hematoma and ecchymosis. In figure B, drainage of hematoma and ecchymosis in the operating room. Well, and the last one. Now you are doing to do an active to fix the content, such as write a concise summary of the topic discussed, physiology of healing and pathophysiology of surgical trauma. This reference that this lesson and thank you. Bye bye.